Dr. Wade, what causes a stroke?
Stroke is a result of a sudden decrease in blood flow to part of the brain.
What are the different forms of a stroke?
Well, there's two basic forms. The most common form is the form where there's decreased blood flow related to a blood clot or a closure of an artery. The less common form is the hemorrhagic stroke, where there's a bleed into the brain.
What are the 5 warning signs of a stroke?
Well, the 5 warning signs of stroke are: first, sudden numbness or weakness in the face or an arm or a leg, particularly on the same side of the body. The second warning sign of a stroke is a sudden decrease in ability to speak, or confusion, or decrease in ability to understand. The third warning sign of a stroke would be sudden decrease in vision in either one or both eyes. Fourth would be decreased coordination, ability to walk, or dizziness. And the fifth is a sudden severe headache without some other explanation.
What is a pre-stroke?
Pre-stroke would be a term also known as a TIA, or a transient ischemic attack, where there can be either incomplete, stuttering, or partial loss of neurologic function related to brief or transient decrease in blood flow to the brain.
What is the treatment for a stroke?
Well, for the most part, the treatment is supportive. If there's a large stroke that is found to be related to a blood clot in the brain, and you can treat it within 2 to 3 hours, and you can do a CT scan to be sure there's not a bleed, then there are blood clot dissolving drugs like TPA that can be very helpful in reversing the acute stroke.
How can I prevent a stroke?
What you can do to prevent a stroke is to be proactive and decrease your risk factors. The risk factors for stroke are pretty much similar to those for heart disease: high blood pressure, high cholesterol, smoking, diabetes. Family history, you can impact all of those with the exception of family history. But to treat all those factors, that's the best thing you can do to decrease the chance of a stroke. Another thing that people can do is, if they can tolerate it and they don't have any problem with it upsetting their stomach or causing bleeding, a daily low-dose aspirin, 81 milligrams, taken once a day with food, can be very helpful in decreasing the chance of a stroke occurring, since most strokes are due to blood clots.
What is SmartBeat, and how can it help determine what my stroke risk is?
SmartBeat is a very good comprehensive screening program that includes anatomic, physiologic, and laboratory evaluation for cardiovascular disease. It's a test that takes about 40 minutes or so to do, and gives you a very good overall screening. Your blood levels are checked of cholesterol, sugar, hormones. Ultrasounds are done looking at the arteries in the neck going to the brain, of the heart, of the aorta, the arteries in your arms and legs. Breathing tests are done evaluating your functional capacity. Photographs are taken of your retina, looking at the blood vessels in the retina to determine if there's evidence of vascular disease. And through this, you can determine A, your risk factors by laboratory values, B, the presence of vascular disease seen directly on the ultrasounds and retinal photographs, and C, the heart and lung function. So for someone who wonders what their risk is and wonders to what extent they need to be proactive, it's a very good, simple screening test, which really is covered by all insurance.